Hey everyone, and welcome. Today, we're going to talk about two of the hardest working, but maybe most overlooked organs in your entire body, your kidneys. I mean, these things are the silent, powerful filters that are just absolutely essential to keeping you healthy.
And I love this quote because it just perfectly captures what they're like. It paints this picture of incredible delicacy, like a master plumber or even a Venetian glassblower would be jealous. Your kidneys aren't just simple sponges. They are these absolute marvels of biological engineering. But that same delicacy, well, that also makes them vulnerable.
And here's where the story takes a turn. A staggering 26 million adults right here in the US have chronic kidney disease. That's a condition where these incredibly intricate organs start to fail. It's a huge, widespread problem, and the craziest part, so many people don't even know they have it.
And that right there is the biggest challenge with chronic kidney disease, or CKD as we'll call it. It's almost always a completely silent condition, especially at the beginning. That's why understanding what it is so important. So let's get into it.
So, what is CKD exactly? Well, first off, it's a progressive disease. This isn't something that just happens overnight. It's a slow, gradual decline. Think of it like a dimmer switch on a light that's being turned down bit by bit over months or even years. And that slow fade is precisely why the symptoms are so easy to miss. And if you need proof of how silent this is, just look at this number. In a big screening program for people who are already at high risk, people with diabetes or high blood pressure, an incredible 98% had no idea they had kidney disease. Just let that sink in. It really is a silent epidemic.
Now, just to be clear, not all kidney problems are this slow, chronic type. It's actually helpful to compare CKD with something called acute kidney injury, or AKI. And this is basically the polar opposite. It's a sudden, super fast loss of kidney function that can happen in just a few hours or days, maybe from something like a bad infection or severe dehydration.
So the best way to think about it is like a marathon versus a sprint. CKD, that's the marathon. It's a long, slow, progressive journey. AKI, on the other hand, is a sprint, a sudden event that, thankfully, can often be reversed if it's caught and treated fast enough. For the rest of our time today, we're going to be focused on the marathon, that long-term chronic condition.
All right, so how do doctors actually track this stuff? How do they measure CKD? Well, it's not some big mystery. The disease's progression is neatly broken down into 5 distinct stages, and it's all based on one key measurement of how well your kidneys are doing their filtering job. And that key measurement is called the eGFR. It stands for Estimated Glomerular Filtration Rate. Now, that sounds complicated, but all you have to remember is that the glomuli are the millions of tiny filters inside your kidneys. So the eGFR is basically just a grade, like a percentage score for how well those filters are working. A higher number is good, a lower number, not so much.
And these 5 stages, they're all based on that eGFR score. It starts at stage 1, which is the mildest form. There might be a little bit of damage, but your filtering grade is still a 90 or above. Pretty good. But as the disease gets worse, that score drops through stages 2, 3, and 4. And by the time you hit stage 5, your score is below 15. That's considered kidney failure, and at that point you need serious treatments, like dialysis or a transplant, just to stay alive.
So what's causing this slow decline in the first place? I mean, who is most at risk? Understanding the main culprits is really the first step toward preventing it. And it turns out the 2 biggest drivers are conditions that literally millions of us already have. That's right. The 2 things that lead to chronic kidney disease more than anything else are diabetes and high blood pressure. And it makes sense if you think about it, right? High blood pressure is constantly hammering those delicate filters with too much force. And high blood sugar from diabetes makes the blood thick and syrupy, basically jamming up the whole system. Over time, both of these just wreck the kidneys.
And the numbers really tell the story here. If you look at all new cases of total kidney failure, diabetes is responsible for 38% of them, and hypertension, or high blood pressure, causes another 24%. Add that up, and you've got over 60% of all cases coming from just 2 chronic conditions that are often manageable.
Okay, but knowing all this is actually really empowering, because this isn't just a doom and gloom story about a disease. It's really a story about prevention and about taking control. There are very real, very effective things that we can all do to protect these vital organs. So this is really the most important question, isn't it? What can you actually do to protect these amazing filters? It's not about waiting for something to go wrong. It's about being proactive and taking care of one of your body's most critical systems right now. And here it is. This is basically the playbook for healthy kidneys.
and you'll see it all connects. The big ones are right at the top. Get that blood pressure and blood sugar under control. But it's also about lifestyle, a healthy diet, getting some exercise, cutting back on salt, and avoiding things like smoking. And finally, it's about being smart and proactive. Talk to your doctor about the meds you take and make sure you get regular checkups, especially if you know you're at risk.
So we'll end on this thought. Your kidneys filter around 200 liters of blood every single day. They are, without a doubt, some of the hardest workers in your body. We know that most kidney failure is linked to conditions we can actually manage. So the question is, are you doing your part to protect them? Thanks so much for joining me.